Hi everyone, welcome back to Neurospicy Nursing. Today's lecture, we're going to be going over the P's of labor. Later on today, I'm also going to be posting a newborn care lecture, so make sure that you guys look at that. I know that I ended up putting up the complications of labor versus normal labor before this one. So some of you guys may have already taken your test on it. I was holding off on this one just because I get why they go over this. This is a topic that didn't really stick for me, but some people requested it, so I'm going to go ahead and put it up, and that way you guys can use it for your finals. Okay, so to start off, there's 5 major factors in the labor and delivery process, and they're influenced by the psyche, the powers, the passenger, passageway, and the position. Those are the 5 major factors that go into the labor and delivery process. So throughout this presentation, we're going to walk through each and every step and how it affects labor. All right, so the first one, psyche. This is a mom's psychological response to being in labor. So they'll have anxiety, fear. It's also going to take into account their support level, their past experiences with labor, if they've had any, and how all of that influences how well she can cope with their contractions, how well and efficiently the labor process is progressing. And we have to make sure that we are keeping our patient calm and supported to ensure that labor progresses more effectively. Okay, so the powers. The powers refers to the uterine contractions that slash the uterine contractions and the mother's pushing efforts, if that makes sense. So mom pushing and how effectively the contractions are happening. And those contractions also break down further into the frequency, duration, and intensity. So we're going to go over that as well. So, uterine contractions. Frequency. Let's talk about it. Frequency is the time from the beginning of one contraction to the end, to the beginning of the next contraction. Beginning of one to the beginning of the next. Duration is how long a contraction lasts, and from the very beginning of one contraction to the end of that contraction. And then intensity, we're going to test the intensity of the contraction by looking at the strength of it, which we're going to assess by either palpating or internal monitoring. So all of these together, when we put them together, they are going to determine how effectively we're going to have cervical changes. Okay, so effacement. Effacement is the shortening and the thinning of the cervix. We want 100% effacement, which means that our cervix has completely thinned out. It's allowed full dilation and the beginning of descent for the fetus through the vaginal cavity, vaginal canal. All right, dilation. It's the opening of the cervix. So it's going to measure from either 0 to 10 centimeters, and 10 centimeters is what we consider fully dilated. So just to put that in perspective, if you've ever seen a pint of Ben & Jerry's, that lid, that is 10 centimeters. So that's what we want to see the cervix looking like, is as big as the top of a Ben & Jerry's ice cream pint. I know that sounds crazy, but that just helped for me. All right, passenger. So the next P is obviously passenger, and this is going to include the fetus and the placenta. So it's how the fetus is positioned and as well as how they are aligned. That plays a major role with how smoothly labor can progress. Okay, so there are different parts slash presentations of the passenger and what part of the fetus is entering the pelvis. So, lie is the relationship between the fetal spine and the maternal spine. Longitudinal is the best. We want longitudinal. Transverse is not compatible with the vaginal birth, so they're going to end up needing to have a C-section. Station is how far the presenting part has descended, with 0 being at the level of the ischial spines Attitude is how the fetal body parts relate to each other, like each fetal body part relating to each other. Flexion is the best. We want flexion. Flexion is ideal. Extension is going to make delivery way, way harder. And then the fetal position, the orientation of the presenting part inside of the maternal pelvis. There's lots of different acronyms for it, but you'll see LOA or ROA. Okay, so position is the last P that we have, and it's all based on how the mom is positioned during labor. For optimal comfort, sometimes changing positions can help relieve pressure in certain areas, again, improve comfort and promote placental circulation. Movement is one of the most powerful non-pharmacologic tools that we have in labor. So make sure that if you see late decels on mom or variable decels, we're going to reposition her right so that the baby has more optimal perfusion in the placenta. And it just helps with mom as well. Okay, so these are my resources. I always use the same resources, but I'm still going to give it to you guys. And thank you guys. All right, look for that newborn care PowerPoint. And then as promised, because I still haven't done it, look for that DIC PowerPoint. That will also be coming out either today or tomorrow. Okay, guys, thank you so much and have a great rest of your day. Bye.